NCLEX practice questions and tests for 2026. Question 1. The nurse is caring for a client who is experiencing unresponsiveness following the administration of an opioid analgesic. The client received naloxone but is still difficult to arouse. Which intervention is the priority? Administer a second dose of naloxone. Assess for a surgical site infection. Place the client in a prone position. Increase the maintenance fluid rate. Naloxone has a shorter half-life than most opioids. The nurse must monitor for recurrent respiratory depression and be prepared to administer additional doses if the client's level of consciousness does not improve. Question 2. A nurse is teaching a 37-week pregnant client about true versus false labor. Which finding indicates that the client is experiencing true labor? Contractions that decrease with walking. Pain felt only in the upper abdomen. Cervical changes such as dilation and effacement. Contractions that disappear with hydration. True labor is characterized by progressive cervical effacement and dilation regardless of activity level. Question 3. An older adult client with COPD presents with confusion and dyspnea. Which acid-base imbalance does the nurse suspect? Metabolic alkalosis, respiratory acidosis, metabolic acidosis, respiratory alkalosis. COPD patients retain CO2 due to alveolar hypoventilation. An accumulation of CO2 leads to respiratory acidosis, which often presents as confusion and worsening dyspnea. Question 4. The nurse is caring for a client with a last menstrual period, LMP, of September 1st. Using Naegele's rule, what is the estimated date of birth, EDB? June 1st, June 8th, December 8th, May 25th. Naegele's rule, subtract 3 months from the first day of the LMP and add 7 days. September 1st minus 3 months is June, plus 7 days is June 8th. Question 5. A client at 32 weeks gestation presents with painless bright red vaginal bleeding. Which action should the nurse take? Perform a sterile vaginal exam. Prepare for immediate vaginal delivery. Maintain the client on bed rest and monitor FHR. Administer oxytocin to progress labor. Painless vaginal bleeding in the third trimester suggests placenta previa. Digital vaginal exams are contraindicated as they can cause hemorrhage. Monitoring and bed rest are essential. Question 6. The nurse is monitoring a client post-surgical repair of tetralogy of Fallot. Which finding is a manifestation of heart failure in this pediatric client? Bradycardia, decreased weight, increased urinary output, puffy eyelids, periorbital edema. Signs of heart failure in infants/children after cardiac surgery include periorbital edema, inappropriate sweating, tachycardia, and sudden weight gain. Question 7. Which action by a new nurse caring for a client with increased intracranial pressure, ICP, and mechanical ventilation requires intervention? Suctioning the client for 30 seconds to clear secretions. Maintaining the head of bed at 30 degrees. Keeping the head in a neutral midline position. Administering stool softeners as prescribed. Suctioning increases ICP. It should be limited to less than 10 seconds and performed only when necessary to minimize spikes in intracranial pressure. Question 8. The nurse is assessing a client with a head injury who has developed SIAD. Which finding should the nurse expect? Low serum sodium, hyponatremia, increased urinary output, low urine specific gravity, hypernatremia. SIAD causes the body to retain too much water, which dilutes the blood, resulting in hyponatremia and high urine specific gravity. Question 9. Prior to ambulating a client for the first time after surgery, which action best ensures client safety? Encourage the client to look at their feet while walking. Dangle the client's legs over the side of the bed first. Have the client take a deep breath and cough. Administer pain medication 5 minutes before standing. Dangling the legs, orthostatic precautions, allows the blood pressure to stabilize and prevents syncope and falls when the client stands. Question 10. The nurse is assessing a sleeping 3-month-old infant. In which order should the nurse perform the assessment components? Mouth, heart, ears, lungs. Heart/lungs, abdomen, mouth, ears. ears, mouth, heart, abdomen, abdomen, ears, mouth, heart. For infants, perform non-invasive assessments, auscultation of heart/lungs, while the child is quiet or sleeping, and save invasive/traumatic exams, mouth/ears, for last. Question 11. The nurse is assessing a 2-year-old client during a well-child visit. Which developmentally appropriate action is expected? Tying shoelaces, building a tower of 6 to 7 blocks, speaking in 10-word sentences, drawing a person with a body and arms. A 2-year-old should be able to build a tower of 6 to 7 blocks and walk upstairs. Tying laces and complex drawing are later milestones. Question 12. A nurse provides an SPAR report, pulse 145, temp 101.2 BP 76/40. The nurse states the client is slipping into septic shock. What critical SPAR info is missing? Situation, background, assessment, recommendation. The nurse provided the situation, background, and assessment but failed to provide a recommendation. Example, I recommend a fluid bolus or I need you to see the patient now. Question 13. A client with hyperemesis gravidarum has a urine-specific gravity of 1.028. Which is the priority nursing action? Start a clear liquid diet. Administer 4 fluids as prescribed. Encourage the client to ambulate. Document the finding is normal. A specific gravity of 1.028 indicates concentrated urine and dehydration. For fluid replacement is the priority for hyperemesis gravidarum to restore electrolyte balance. Question 14. The nurse is preparing to administer a vaccine to a 7-month-old infant. Which site and needle length is most appropriate? Deltoid 0.5 inch, vastus lateralis 1 inch, vastus lateralis 1.5 inch, dorsogluteal 1 inch. For infants under 12 months, the vastus lateralis, thigh, is the preferred site for IM injections. A 1-inch needle is standard to ensure reach into the muscle. Question 15. A client with polycythemia vera, PV, has a hematocrit of 55%. Which statement by the client indicates an understanding of the condition? I will take an iron supplement daily. I should limit my fluid intake to 1 liter a day. I will wear support stockings and elevate my legs when sitting. I will use a firm bristled toothbrush. PV increases blood viscosity and risk of thrombus. Elevating legs and staying hydrated help prevent clots. Iron should be avoided as it stimulates RBC production. Question 16. The nurse is caring for a group of clients. Which client is at the highest risk for oral candidiasis, thrush? A client with a history of hypertension. A client using an inhaled corticosteroid for asthma. A client with a fractured femur. A client who is 10 weeks pregnant. Inhaled corticosteroids, like fluticasone, can suppress the local immune response in the mouth, leading to fungal overgrowth if the mouth is not rinsed after use. Question 17. A client with a right forearm cast for 3 weeks makes which statement that requires further education? I can use a cool blow dryer if my arm itches. I will call the doctor if my fingers feel numb. I like to use a ruler to scratch deep inside the cast. I will keep the cast dry during my bath. Nothing should ever be inserted into a cast, like a ruler, as it can break the skin and cause an infection that cannot be seen. Question 18. The nurse is caring for a client with chronic emphysema. Which breathing technique should the nurse teach to improve gas exchange? Rapid shallow breathing, pursed lip breathing, chest breathing, deep gasping breaths. Pursed lip breathing creates back pressure in the airways, keeping the alveoli open longer and allowing for more effective CO2 removal. Question 19. The nurse is caring for a team of clients. Which client should the nurse see first? A client with a scheduled dressing change. A client reporting a headache after a nap. A client with a chest tube who has sudden onset of dyspnea. A client who needs discharge instructions. Airway and breathing take priority. Sudden dyspnea in a client with a chest tube could indicate a tension pneumothorax or tube displacement. Question 20. The nurse is assessing a 1-month-old with suspected hip dysplasia. Which finding supports this diagnosis? Symmetrical gluteal folds, negative Ortolani maneuver, asymmetric thigh folds, equal leg length. Asymmetric thigh or gluteal folds and a shortening of the limb on the affected side are classic signs of developmental dysplasia of the hip. Question 21. The nurse is teaching a class to decrease the risk of SIDS. Which information is most important to include? Place the infant on their side to sleep. Use soft bedding and pillows in the crib. Place the infant in the supine, back, position to sleep. Keep the nursery temperature at 80 degrees. The Back to Sleep campaign emphasizes the supine position as the most significant factor in reducing SIDS risk. Question 22. A toddler presents with a sore throat, inspiratory stridor, and a fever of 103.1 F. What is the priority action? Examine the throat with a tongue blade. Obtain a throat culture. Prepare for a lateral neck X-ray. Keep the child calm and notify the provider. These are signs of epiglottitis. Any agitation or throat examination can cause a total airway obstruction. Keeping the child calm and notifying the HCP for emergency airway management is vital. Question 23. A client is bottle feeding her newborn and experiencing breast engorgement. What should the nurse advise? Express a small amount of milk by hand. Apply warm compresses before feeding. Apply cold cabbage leaves to the breasts. Use a breast pump every 2 hours. For non-breastfeeding mothers, the goal is to suppress lactation. Cold cabbage leaves and avoiding nipple stimulation/heat help reduce swelling and stop milk production.